What I thought I'd do today is just go over briefly what some of our goals were and what some of our plans are. What our goals are, some of our partners, what are some of the ongoing statewide projects to prevent cervical cancer, and what some of our next steps and opportunities are. As you've seen from other presenters today, this is a map of Texas that shows incidence on the top and mortality on the bottom, and red is bad. That's where the rates are highest, and as you can see, Texas excels in having high incidence and mortality rates, particularly along the Texas-Mexico border and in East Texas and in the Panhandle. And that pertains to both incidence and mortality. We also have a disparities problem in Texas related to cervical cancer incidence. These are incidence data, but mortality data also tracks that. And as you can see, there's been a gap that's persisted over time with Hispanics and African Americans having higher rates than whites, and this gap has narrowed somewhat for African Americans and less so for Hispanics. The percentage of women in Texas who've had a Pap test and are adherent to guidelines, again, red is bad, and Texas also exceeds or is joined by several other states in having lower rates of cervical cancer screening with the Pap test. We're also among the states that are in the bottom 50% in terms of delivering the HPV vaccine to adolescents, and only about 39% of adolescents have received at least one dose. And we're also in the bottom 50% of the states where there's adolescents have completed the series of HPV vaccinations. So there's a lot to do, and we need to do more, as others have said today, and we're really ready and poised to do that. Our goals are very similar to those of our partners in that we want to increase cervical cancer screening with the Pap test so that women are adherent to guidelines. And as someone said earlier, we think it's important to both address the issue of over-testing as well as the issue of under-testing. We are targeting also the initiation and completion of HPV vaccine among adolescents and young adults. And I put HPV testing as part of a cervical cancer screening with a question mark because, as others have said today, the U.S. Preventive Services Task Force and other organizations are reviewing their guidelines for cervical cancer screening, and there's some likelihood that they will incorporate co-testing into those guidelines. We can only hope. These are some of our partners, and I've highlighted here the Cancer Prevention Research Institute of Texas, or known as CPRIT, in that this is a unique opportunity for us to do research in Texas. CPRIT was funded, mandated by the Texas legislature in about 2007 to fund cancer research in Texas to the tune of about $300 million a year for 10 years. And they fund both research and prevention grants, and the prevention grants must include a service delivery component that uses evidence-based interventions to deliver cancer screening interventions to Texans. These are some of the grants that CPRIT has funded. In fact, they've funded 24 grants that include cervical cancer screening and or HPV vaccination. And one of our opportunities is to, and I've talked with the prevention director of CPRIT about the possibility of bringing the investigators of these grants together, and they're funded all around the state, to see how we could leverage the work they're doing in the interest of cervical cancer-free Texas. These grants all target disadvantaged populations, and but others target other groups as well. And our next steps and opportunities, I'm not going to read through this slide, but I would say that one opportunity that we have not mined in Texas is doing school-based programs. And we are really uniquely positioned to do that. We have a CDC-funded prevention research center, and our signature project as part of that focuses on adolescent sexual health. Texas has another distinction of having one of the highest teen pregnancy rates. And so as part of the education program, sexual health education program, there may be an opportunity to incorporate education about HPV. So I'm exploring that with our director of the PRC, and she's very interested and excited about that possibility. So that's it.